everybody. Welcome back to another episode of Medicare Matters with Mackenzie, the podcast where we break down health coverage without the headaches. I'm Mackenzie Anderson, and today we're diving into something super important for our veterans out there, how Medicare works with VA benefits. With me today, I have Adela Cochrum, a USMC veteran, principal agent, and CEO of the Cochrum Group. So thanks for joining me.
Yeah, thanks for having me.
So Adela, tell me a little bit about yourself and how you got started with Medicare.
Okay, well, I started back in 2004. I am a Marine Corps veteran, as you said.
Thank you for your service.
Thank you for your support. Well, I started in insurance as kind of one of those things that I just fell into.
Right.
Going through a divorce, and talked to my mom. My mom was an insurance agent, and she said, try insurance. So in 2004, I went ahead and got my license. I wasn't one of those that just dove into Medicare or into insurance. I was one of those that said, I'm going to get my temporary license and just try it.
I didn't even know you could get a temporary license.
Back in the day, you could.
Okay.
And so I got my license, and I went to work for this company that they specialized in Medicare supplements.
Okay.
And that's what I did. And it was shortly after my father was diagnosed with prostate cancer. So kind of like really dove into it.
Right.
And really saw
out of necessity.
Yeah.
To help him out, yeah.
So, yeah.
Okay. And we have actually known each other for quite some time.
Yes.
So I think we met in 2017.
Probably right around there, yeah.
I was working for a provider group who only did Medicare, and Adela was one of the agents, and it was part of my job to help get agents involved with different different providers and do events. And so at some point, actually in July of 2017, I made the transition of actually being an agent myself. And we remained really good friends. I always came to her with questions. I viewed her as a mentor. I still do. And so now about 2 years ago is when we got together and we joined. So I'm a part of her group, and which is called the Cochrum Group.
The Cochrum Group.
So that's how we met and share ideas and
absolutely
and knowledge. So she's very, very valuable. Has a wonderful knowledge about the VA and everything. So tell me, Adela, why does the Cochrum Group focus so much on veterans?
Well, it's near and dear to me, being a veteran.
Right.
Right. We are actually located inside a veteran hub. And
we are.
So we see veterans on the daily, right? So It's very important because a lot of veterans don't realize that they're the only segment of the population that can have dual coverage, right? Meaning they can have their own plan, whether it's VA or TRICARE, but they can also have a plan on the outside that helps them get those services that they need on the outside that they might not get inside the VA.
And so you being a veteran and your husband, Mike, being a veteran, you've had a lot to do with the VA. So what's been your experience?
One of my experiences, well, I've had many, just as every veteran has, right? The lack of being able to get care when we need it, right? Being able to just access health care in an emergency or
just as a regular appointment.
Just as a regular appointment. It's so hard to get one.
It is.
And if you get one,
it might be canceled.
Exactly.
My husband is trying to use the VA. Unfortunately, fortunately, he's not on Medicare. But he's had an appointment the other day, and it was rescheduled from a cancellation. And this is the backup doctor, and it was just a phone call. So it's really hard.
Yes. Actually, that happened to me on Monday. I got a phone call. I had an appointment for a mammogram that I've had on the books for several months now. And they called me at 7:30 and told me that they had to reschedule. And I said, no, I have another appointment there. And I took the day to come. So they went ahead and they fit me in. But I was lucky. That doesn't happen all the time.
No, I was gonna say that. That's pretty cool.
That's one of the exceptions, I would say.
Mhm.
But one of the biggest things that really drives my passion is having the personal experience. And
Mhm.
one of the things that is it happens, and it more often than not,
Right.
right? That we don't want to see. In 2015, my husband was misdiagnosed by the VA system
Mhm.
in Temple, and he actually went into a coma. They misdiagnosed him. They kept saying he had pneumonia. In reality, he had congestive heart failure and fell into a coma. Got him to be seen on the outside. Uh, and the VA wanted me to bring him back to the VA, and I said, no, I'm not, and took him to Round Rock. And my husband fell into a coma, went into complete organ failure,
Mm.
and got the VA to manage to get an approval, but I had to jump through hoops to
Right.
get that. You know, I had to get John Carter's office involved and a bunch of other stuff. So
Right.
the cool thing is that sets us apart, right?
Right.
Our agency apart is the fact that when I was in the Marine Corps, I worked congressionals at headquarters Marine Corps.
Oh.
So I know how to navigate those
Right.
waters. And in turn, we've shared that among the agents.
Right.
Our agency is one of the, I would say, is the only agency
I think so.
in this area that we have to get completely certified before we work with our veterans. So our agents are very knowledgeable as far as what works with what and what plans coordinate with things. But got the VA to approve his transfer, but my husband was in a coma for a month and a half. So that drives my passion to make sure that that doesn't happen to our veterans.
Right.
And so, yeah, so that's the big drive behind that.
All right. And so there are different types of VA coverage, right? So my spouse, he did 3 years active, 1 year reserve, and so he has VA health benefits, but it's service related for any sort of disability or something that happened to him while he's there. So that's one, right?
That is one. Absolutely. So to have access to the VA, it used to be very hard to get, but with recent administrations in the past, in 2008, they made it to where veterans could, as long as you served for 24 months, active duty, and you were honorably discharged, you could get access to VA health. Now, anybody can go if you have those two criterias and go into the VA system. But there are, like you said, your husband has that service-connected disability that allows him to get more services than just your normal veteran going in for
like a
services.
physical or something like
Yeah,
that.
well, they can get like dental and vision depending on the amount of disability they have.
Right, right. And then another one is TRICARE for Life. Now, this is the big one, right?
Yeah.
So in order to have this, you have to have 20 years consecutive years of
Active duty.
service, right?
Yes.
Active duty service. And so with TRICARE for Life, it's going to be completely different than any other. And then do you have anything to add on TRICARE
Well, TRICARE is
for Life?
Yeah, TRICARE for Life is of course that's the top tier that everybody wants to have, right? But you do have to put in that 20 years and be honorably discharged to have that.
Right.
So, but yeah.
And then we have CHAMP VA. CHAMP VA is for dependents, survivors of those who have died, or disabled as a result of their service.
Right. And they can have those benefits, and those are for like spouses and children, and children up to, I want to say now it's changed up to 26 kind of thing.
Okay.
As long as they're in school.
Right.
But yeah, they can have access to that. So not every spouse or
Right.
family member can have it.
Because they have to have died as a result of the disability, or they have a disability.
Right.
And
Being medically discharged.
We just talked about the different types of VA health coverage that somebody can have as a result of service and being related to those who have service. So what are the best types of Medicare plans for those who utilize the VA? Now, if you're over 65, you have to have Medicare, right? Especially if you have TRICARE for life.
Right. If you have TRICARE for life, you must be enrolled in both A and B in order to get your TRICARE. Now, one of the disservices that happens within the VA system, they have misled our veterans in some instances and told our veterans that they don't need to get Part B, which
they had been doing that.
Yeah, and so what happens is you'll have some veterans that got their Medicare years and years ago, and then they encounter that penalty. Veterans are not exempt from obtaining Part B. Every veteran must have Part B.
So if they were to go into the hospital, then the Medicare would pay, the Part A would pay the first portion, then TRICARE for life would pick up the second, but then just for the room and board, right?
Right.
And so any sort of any doctors that came in,
or on the outside, right?
The outside,
so
right.
Like, if they have to go to, they don't encounter that if they go to Temple, right?
Right.
The VA hospital. But if they go to the outside, now there's follow-ups, right? With doctors' offices that they have to go to, but they don't have Part B services. Right. So, and now they have to pay a penalty for that.
Right.
So,
that's a potential of what could happen there.
Yeah.
Okay. So everybody needs A and B, and those are the basics of what you need in terms of getting some other coverage outside of the VA in terms of private individual coverage with Medicare. Now, last month we talked about Part A and Part B, and we went into all the different costs there and how it works and how you really just don't want to be stuck with just A and B. We're not saying that just because we help people with their insurance, but it does leave you at quite a bit of financial risk. And so part of having these additional coverages, especially when you have the VA, what we do is we help to mitigate those risks, pitfalls, anything like that could happen.
Right.
So if we're looking at Medicare Advantage plan, what are we looking for? What should somebody be looking for if they want some coverage for that?
Okay. Well, there's, of course, you have your MAPDs, which are your Medicare Advantage plans that have prescription drug plans in it. And then you have your regular MA plans that is just a Medicare Advantage.
Those, health only.
Just health only, no drugs. Okay, so you have no prescription benefit on that. That works well for people who are either TRICARE or just seeking their services inside the VA, right? And they get their drugs from the VA.
Because if you have TRICARE for life, why wouldn't you want to have a plan that has drug coverage in it?
Because TRICARE for Life already has a plan on the outside for them. So they don't need that double coverage.
Right. So if somebody does mistakenly sign up for it, what can happen?
It depends on the plan that they choose.
Right.
So some plans will coordinate with TRICARE and some of them won't.
So they could be responsible for those costs.
Right.
Then they don't have to pay for medication.
Exactly.
Right.
Exactly. So there's just no need for it. Right. And so, of course, then you have your people who are VA. Those, they can have either one of those. Right. But the advantage of, like we said before, veterans are the only segment of the population that can have this dual coverage. So it's very important to talk to somebody who specializes in this.
Right.
As we do.
Yes,
right.
We do.
And so helps you to we help you to coordinate all these benefits, right? To ensure, are you getting what you need? When we talked about VA and we said service connected, if these plans, some of them will give them benefits that they might not have at the VA because maybe they're not service connected. So it gives them additional benefits like dental, vision, hearing.
In varying quantities.
In varying quantities, right. And they also get a reduction in their Part B, so why not, right?
Right.
So,
on some plans can have that reduction in the Part B.
Yeah.
Others, low to no premium there. So for somebody who, let's say all of their doctors are in the VA, okay, since all their doctors are there, they get all their prescriptions from the VA because they're prescribed.
Okay.
So having that Medicare Advantage plan, how does that helps them to access providers outside of it? Like you were mentioning with Mike, with your husband.
Yes. So one of the things that we do here is help you navigate those waters, right? Because it can be a little, if left for you to figure it out on your own, can be a little tricky, especially if you don't know what you're doing.
Right.
So that's one of the things that we do is we help you find a doctor on the outside. So basically what we're going to do is mirror your doctors. So if you have a cardiologist on the outside, on the inside, we're going to get you a cardiologist. On the outside, primary care. For whatever, you have an endocrinologist, whatever. We want to make sure that we get those doctors on the outside talking with those doctors on the inside of the VA system, get them talking to each other so they're on the same page and each one knows what the other's prescribing and why they're prescribing it. Because they might feel like one drug is not working as good as another one. Then basically what that creates is two sets of eyes on your healthcare,
right,
instead of just one, right? Which proves to be such an advantage because if you just have one set of eyes on you, even though you have a primary and a specialist, right? They don't always talk to each other. No. So having those two sets of eyes on your healthcare gives you better healthcare as a result, right? So why not use that?
Right. And part of having the outside doctors speak with the inside doctors, it helps with your medications also.
Absolutely, because there might be medications that inside the VA will be no cost, or maybe it's on the outside that it's no cost because of the new restructuring of formularies, right? So those are the things that we help navigate.
Right. And so we help save some money there. So in our office, you said it's in a veteran resource center. What's it called?
Heroes Resource Center. Used to be Heroes Night Out.
Right. And so where are we located?
We are located at 1150 South Bell Boulevard, Cedar Park, Texas, 78613.
Yeah, that's the right one.
Building 5.
Building 5.
Yes, Building 5.
And it's up on top of the hill. Once you drive there the first time, after that it's much easier to find.
Yeah.
The first time can be a little bit more difficult.
Yes, and this location has probably been here for about 40 years.
Really? I didn't realize it had been that long.
Yeah, and it's well, Heroes has not been here this long, but people are familiar with this site,
right?
Because they always called it the church on the hill, so every time people go, oh, I pass that all the time, but yeah, so we've been here. The agency's been here a little over 10 years now.
Wow.
Yeah.
Wow. So tell us a little bit about what Heroes does.
Heroes is a veteran hub, and the reason they changed their name is because it used to be veteran and active duty and their families. Now it's called Heroes Resource Center because they actually serve also our first responders, so police department, EMS, firefighters, and so on. So doctors, nurses, that serve the community. So they have a lot of services here that their families can come and access for free or little cost. So it is, like we said, it's a hub for all these VSOs, which VSOs are veteran service organizations that help with either legal
Mental health.
Mental health, people that help people file for disability, and financial help. Us,
Yeah.
So there's a lot of different VSOs that are here. So on site, and depending on the day, just you want to go to the website. The website is heroesnightout.org. So the website is still the same. So heroesnightout.org, and look at all the different
things that are going on,
and the different services they provide.
So I know on Tuesdays and Thursdays, group of vets get together for donuts and coffee, and they just chit chat, and so there's always room for more. So we definitely encourage you to do that. And if you have any questions, the information will be up on the screen after this. So now there is something pretty exciting coming up.
Oh, yes. May 24th is the annual Heroes Night Out, or Heroes Resource Center annual picnic. That is a military and first responders appreciation picnic that has been held every year during Memorial Day weekend. This year it's on the 24th is when they're having it. And it is free to all families. They don't pay anything, but you want to come out because they will have every VSO that's in the area comes out, and you can get to see what kind of services are out there and available to you.
And just meet with like-minded, because I know with your son, your son is also in the military, served.
Yes.
And it was really cool for him to see and connect with other people that had gone through similar experiences with him.
Yes. And it is, like I said, it's a fun day of just meeting with fellow veterans and their families and forming new relationships. And they have jump houses, they have swimming, they have paddle boats and free barbecue and music. So you definitely don't want to miss it.
And where's that going to be?
It is at Reunion Ranch in Georgetown.
Okay, great. And if anybody has any questions, can they just go to the website heroesnightout.org?
Okay. And register for the picnic.
Oh, you do have to register.
Yeah, register for the picnic because, it is free barbecue, and they have some of the best pit masters that come out.
They do. It was really good.
Yeah, they're really good.
Yeah, it is really good.
And of course we'll be there as well.
And so, and if you have any questions for us, please reach out. But thanks for listening to another episode of Medicare Matters with Mackenzie. We'll be back next month with another great episode. If you have any questions or if there's a topic that you want me to cover, please call me at 512-599-9527, or you can send me an email at mackenzie@premiermedicaresolutions.com. And then Adela, how can they reach out to you?
Just at 512-627-3475, or we're here at the office at 1150 South Bell Boulevard, Building 5, Cedar Park, Texas, 78613. Or you can try us at the main line, which is 512-354-7661.
All right. Well, thank you so much for joining me, and look forward to another one soon.
Yes. Thank you.
Thanks for listening to another episode of the Medicare Matters podcast with Mackenzie. Please make sure to subscribe wherever you get your podcasts so you don't miss an episode. Please also leave a review, as that helps me reach more people that can benefit from this podcast content. If you have questions or topics that you want me to cover for a future episode, please email them to Mackenzie@premiermedicaresolutions.com.